Hello everyone, my name is Dr. Pednikar. I'm a neurologist here with Carson, Tahoe, and I also have specialized training in stroke and vascular neurology. Annually, about 800,000 people within the US end up having a stroke, and this amounts to about one person every 40 seconds who ends up having a stroke, and every 4 minutes, actually, someone dies of a stroke within the country. This actually makes a stroke the fifth leading cause of death within the country, and it's also the leading cause of disability in America. Stroke is really a broad term, but it's used to define three main types of conditions. The first is known as an ischemic stroke, and this is the most common type of stroke. Approximately 85% of all strokes are ischemic in nature. These types of strokes happen when a brain artery is suddenly blocked off either by a clot or a plaque. And this is most commonly seen in patients who may have an abnormal heart rhythm called as atrial fibrillation, where it predisposes the heart to form clots that can then go to the arteries of the brain and cause a stroke. And the other common cause is a condition known as atherosclerosis, which is basically just a lot of plaque that builds up in the major arteries going to the brain. And sometimes this plaque can break off and also block a brain artery. The second time we use the term stroke is also for conditions like a brain hemorrhage, which is also referred to as an intraparenchymal hemorrhage. And this type of condition commonly occurs in patients who have high blood pressure, and typically it involves an artery that ruptures in the brain and causes bleeding into the substance of the brain. And the third type of stroke is called as a subarachnoid hemorrhage, and this typically happens when you have an abnormal blood vessel, like an aneurysm, and the aneurysm can rupture and it can cause bleeding onto the surface of the brain. Oftentimes I have my patients when they'll speak in terms of what's a mini stroke, and this is essentially just another term for a transient ischemic attack, or a TIA. And what that stands for is just a transient occlusion of a blood vessel, which then restores blood flow, and therefore patients are not left with a permanent deficit or any permanent damage. So who is at a risk for stroke? So there are certain conditions that are a part of our genetic makeup that confer a certain advantage or disadvantage based on our race, gender, ethnicity, as well as our age. And these factors are unfortunately not modifiable. However, there are certain other conditions that are acquired during the course of our lifetime, things like high blood pressure, diabetes, high cholesterol, cardiac disease, and also certain behaviors like smoking, drinking, alcohol use, physical inactivity, and obesity that I feel are deeply rooted in our lifestyle choices, and with appropriate measures are certainly modifiable. An easy acronym to keep in mind is called Be Fast, and it simply stands for certain signs and symptoms that we may observe in a stroke. B stands for balance disorders like a sudden onset of imbalance. E stands for eye or vision problems of sudden onset. And then F stands for face, like a weakness on one side of the face. And A stands for an arm or a leg, so it's a sudden onset of a weakness in one arm or one leg. And S stands for speech disturbances like inability to bring the right words out, or sometimes having perfect comprehension, but when the speech comes out, it's very garbled. And then T stands for time, and that kind of just points to the fact that time is of essence here, and so it's important to call 911 as soon as you recognize these signs and symptoms in a friend or a family member or loved one. Oftentimes when I'm talking to my patients and I ask them why they didn't seek immediate treatment, one of the reasons I hear often is that they didn't recognize the symptoms, but more importantly, it seems like they didn't recognize that it was an emergency, or they felt that nothing could be done. So treatment for acute stroke is primarily a clot-busting medication called as IV-TPA. This treatment is typically instituted within 3 hours from the onset of stroke-like symptoms, but in certain exceptional cases, this time window may be extended beyond 3 hours. And then the second treatment is that in some patients where they have a clot sitting in one of the major brain arteries, with the help of skilled physicians like neurosurgeons, neurologists, or even radiologists who have been trained in taking these clots out, and with the help of advanced imaging, we're able to actually access these vessels and take the clot out with certain devices called as stent retrievers. I cannot emphasize enough that both these treatments are extremely time sensitive, and therefore it is of utmost importance to present to the hospital as soon as possible when you recognize stroke-like symptoms. So here at Carson, Tahoe, we have a multidisciplinary team that really helps take care of any patients that present with stroke-like symptoms within the hospital. And this, for me, starts at the level of the EMS. As soon as they recognize the stroke-like symptoms, they do alert our emergency department physicians who have necessary protocols in place in collaboration with the University of Utah to determine what patients might be ideal candidates for the clot-busting medication versus what patients may require to be transferred out to higher level of care where they may require endovascular or mechanical thrombectomy. We also have a team of ICU physicians as well as hospitalists and also a team of our nurses that help take care of our stroke patients once they do get admitted to the hospital, and a very robust team of physical therapists, occupational therapists, and speech therapists that provide both inpatient and outpatient rehab services.